This is the 14th and last video in the Ethics and Legal Considerations in Animal Chiropractic. In this video, I'm going to wrap up our discussion about record keeping. Now, this particular regulation applies to veterinarians, and animal chiropractors need to be aware that veterinarians may have specific requirements for what needs to be in their records. Now, I've not seen this in the regulations that apply to treatment of humans. There are other standards, of course, for what needs to be in the patient's records. But it's pretty clear in the veterinary world that there seems to be several states that have statutes that identify very specific information. So some of this is you're going to have anyway, things like the name and address of the client, patient's identity and the patient's history, dates of visits, immunization records, patient's weight if required for diagnosis. If it's a large animal that may be difficult to weigh, the weight may be estimated. Temperature if required for diagnosis or treatment. Any lab analysis, any radiographs, names, dosages, etc. for any drug prescribed or administered. Other details necessary to substantiate the examination, the diagnosis, or the treatment provided, or the surgical procedure performed. Any signed acknowledgement, like the acknowledgements of about alternative therapies like animal chiropractic. Each entry in the patient record shall identify the veterinarian who performed or supervised the procedure recorded. So chiropractors, pay attention. When you create a patient record, you should be identifying who the veterinarian is who is providing supervision for that care. And lastly, I want to talk again about changing your records. Be sure you correct your mistakes in an appropriate manner. If you change the file after a claim is made, causes you to lose all credibility. Every once in a while, there'll be a situation where a doctor goes in shortly after they are served with a lawsuit and decides to clean up or correct the records. That is not a good thing to do. It is dishonest. And if you get caught at it, it's one thing to make a poor judgment call. It's one thing to make a careless mistake. But showing that you were dishonest, now it becomes very hard for you to testify and have any credibility in front of the jury. So it's a huge mistake to make changes to your file after the claim is made. Now, if corrections need to be made and they're made in an appropriate manner, that may be okay. But you want to discuss that with your attorney and be certain that you're doing it properly. Losing the file. Again, every once in a while, the healthcare provider will lose the file. That can create a rebuttable presumption of negligence. So, in other words, you are liable for damages, and the only question is going to be, what is the amount of damages? So that's the kind of mistake, if you make it, whether it's intentional or accidental, that kind of mistake can cause you to lose credibility and can limit your ability to defend any kind of malpractice claim. Of course, losing a critical part of the file can also result in the same situation. And for spoliation of evidence, meaning you've changed evidence in a dishonest manner, or lost evidence in a dishonest manner, the court can enter sanctions up to and including a default judgment against you. So these are all just, general, again, I think this is general common sense, but you don't want to be making these mistakes. You don't want to be caught in a situation where you were tempted to make these mistakes. I am telling you now that the consequences are severe enough that it is not worth the risk that you might be caught. So we've talked about ethics briefly. We spent a fair amount of time talking about licensing, and I would love to be able to tell you that there is a very simple, clear licensing rule to follow. But as you can see, most of the licensing rules are not clear. Most of them are ambiguous. They are not consistent from state to state. So whatever state you are practicing in, pay attention to what the current rules are in the regulations and in the statutes. Be very conscious about following those rules carefully. We also talked about informed consent. And again, I think it's value in educating and building a relationship with the client. We talked a little bit about malpractice claims and some things you do not want to do to make them easier than they need to be. And we talked about record keeping, which again is primarily common sense to me. So I'll just share a few of these. I'm not going to read all of these to you. You could do that on your own. It's there for fun. Um, I like the second one. Life is simpler when you plow around the stump. Instead of trying to cross the regulation and disobey it, just follow the rules. And if the rule needs to be changed, work through the system to try to get the rule changed. Every path has a few puddles. No matter what kind of practice or what kind of business you're in, there are going to be some bumps along the way, and that's okay. You should expect those to occur. Uh, if you find yourself in a hole, the first thing to do is stop digging. Too often I see people violate that rule over and over and over, and it just makes things worse and worse. Um, Letting the cat out of the bag is a whole lot easier than putting it back in. That especially applies to secrets. If you have confidential information, you may be tempted to share it. It may be good gossip. But if once you have let that cat out of the bag, it's a whole lot, it's a lot easier to let it out of the bag than putting it back into the world of confidentiality. Um, and then this last one, if you get to thinking you're a person of some influence, try ordering somebody else's dog around. Now, dogs know who they belong to, and they know who they're going to, uh, uh, whose orders they are going to follow, whose orders they are going to ignore. If you have questions, please feel free to reach out to me. Uh, my email is either jgreen@jessegreen.us or jgreen@parker.edu. I'll try to respond to those as quickly as I can. Thank you.